So PAD is peripheral arterial disease. Some people refer to it as peripheral vascular disease. And it is just a term that generally refers to the peripheral, meaning the limbs, specifically the legs, that are an indicator of your overall health, at least your overall vascular health. Specifically, we want to know if you have peripheral vascular disease, very good indication that you may have coronary artery disease. In fact, the number one killer in the United States is heart disease, right? And that heart disease is atherosclerosis or coronary artery disease as well. Especially in women, it's a silent killer. And so you may not know that you have a heart problem. Well, the simplest, easiest way for us to catch that is by doing peripheral arterial disease screening, and that's what we offer. Most people have had a blood pressure done of their arm, and it's very similar to that. We just basically do a blood pressure test of both of the arms, both bicep areas, and then we do it along the entire length of both legs. And we compare the pressures on both. It's non-invasive, painless, and it's a simple, pretty quick test. And based on the numbers that we get, we see if there's a problem. We also actually interview the patient, ask them if they've had leg pain and whatnot. But the screening is a very simple procedure. Anyone that has a family history of heart disease, for instance, anybody who has leg pain or a history of atherosclerosis or high cholesterol, well, then we could address the problems. For instance, let's say you rule in for having an abnormal test, such as we have to be concerned about coronary artery disease or other things. Then we do the full workup. We check their cholesterol. We check the patients. We may have to get an EKG. We may have to go through the family history and see what else is going on. But one of the most important things is to check their vascular status and look at their blood work, such as cholesterol. And then we attack it at that and try to prevent any future occurrences of coronary artery disease or peripheral vascular disease. It's just a general screening for us to look for the overall health of the patient's vascular status. It's a very simple procedure. It's like getting your blood pressure checked.